countries, and it points in the same direction. And when we have our global IYCF report early next year, we would have more data around that. A quick note on IYCF in emergencies. We know how difficult it is to reach complementary feeding in many countries, as we see in emergency situation. We understand that it's even more difficult. We see how much is important to keep to have breastfeeding as one of the main components of complementary feeding. And in emergency situation, breastfeeding is often jeopardized, as we know, because of myth that the mother cannot breastfeed if she's under stress, the fact also that there is often opportunities from those companies to provide the infant formula, so on and so forth. And the challenge around the complementary feeding also, if it's in a food insecure area, it's new food sometimes that is given to the child. We're seeing that right now with the Syria crisis, where in transition the kids are being given food jar and they have never eaten that before, and in fact they don't like it. They don't. So all those challenges that are faced in emergency are important to consider, because we have many countries who are from one day to the next can go into emergency mode. Lastly, around complementary feeding and illnesses, our colleague in the South Asia office, UNICEF, did a review of the relationship between infant feeding practices at time of illnesses, during and after illnesses, and what they found in South Asia and with using the DHS data. And in fact, they found very little data on the link of IYCF during pneumonia and fever. The data that were available were mostly during diarrhea. There was basically no data around after illnesses. So a big gap of understanding what's going on there. And just to illustrate, in the case of India, what we see in terms of the most common practices in the younger children would be to basically give more or less the same amount of liquid. In older children, what we see was to give more or less the same amount of liquid or less, and less food. And the review of literature that they've conducted for that same period, from between 1990 and 2014, really show that there's really suboptimal practices during illnesses, common illnesses, and it's so an important area that we feel we need more information also, because in some countries kids can spend half of their life being ill in the first 2 years of life. So if we don't understand well what are those practices, the feeding practices at that time, here we're kind of a bit missing the boat. So it's important to dig a bit more into that. And also to recognize, from this review of literature, that health professionals also give little or no advice to caregivers during illnesses. So also another point where we can definitely emphasize a bit more. So I will conclude, and I hope that helps to save a bit of time, that continued breastfeeding is really key during complementary feeding period, and we need to continue to promote and support it. The minimum dietary diversity is the main challenge across the regions, and in Africa, the issue of minimum frequency is also quite important. This large disparities in dietary diversity depending on the well quintile, and same observations whether it's urban and rural area. In emergency situation, a big challenge around complementary feeding, and we need definitely more, better understanding, more data around feeding practices during and after common illnesses. And I want also to thank my colleagues in data analytics to help with some of the analysis, and also to Victor and Kajali with the review on common illnesses and IYCF practices. Thank you very much.
Thank you, Fran, for a very comprehensive and, I would say, mind-stimulating presentation. She covered all the aspects of the global, in terms of overview about the infant game feeding practices across the world. I think we would like to, switch over to the third presenter, and then it would be good that we take a couple of questions after that. Our third presenter is Lisa Price, and she's got a background in public health. Lisa has worked with Care International since 2011. Based in the Asia Pacific Regional Office in Cambodia, She has worked on evaluation of HKI's enhanced homestead food production program in Cambodia and Nepal, and for the last 3 years has coordinated the assessment and research on child feeding. That's called as ARCH project in the region. The ARCH project seeks to build the empirical evidence based around the promotion and commercially produced foods consumed by the infants and young children. Elisa has previously worked on maternal child health and nutrition programs and has a research in India, Nigeria and United States. And she's currently a PhD candidate at the London School of Hygiene and Tropical Medicine. Over to you, Elisa.
Thank you very much. Good afternoon, everyone. It's an honor to be here. As mentioned, I work with Helen Keller International on a project that's been conducted over the past 3 years, the ARCH project, Assessment and Research on Child Feeding. And this afternoon, I want to present findings from one study of this project that was looking at consumption of commercial foods during the complementary feeding period, with a particular focus on the consumption of commercial snack foods. This is in urban Cambodia, Nepal, Senegal, and Tanzania. So just a little bit of background on this project. The ARCH project was aimed to gather information on the marketing and promotion of commercial food products that are commonly fed to children under 2 years of age, and also the utilization of these products. So this included breast milk substitutes, commercial complementary foods, and commercial snack foods. And there has been some research done on marketing and promotion of breast milk substitutes, but we felt that there was a lack of evidence and information on what types of marketing and promotions were occurring for commercial complementary foods and also snack foods. Furthermore, there are a range of countries that have DHS data on the consumption of sugary snack foods, but we wanted to look at the broader range of snack foods that can be consumed by young children, including sugar-sweetened beverages and savory snacks. We included 4 countries in this project. They included Cambodia, Nepal, Senegal, and Tanzania. We looked at the most populous city in each of those 4 countries. And these are countries where the burden of undernutrition among children under 5 is very high. We see around 40% in Cambodia, Nepal, and Tanzania, and 19% in Senegal. As Frans mentioned, the impact of complementary feeding on stunting is very influential, and these are places where we see in Cambodia and Nepal, few children are fed in accordance with WHO recommended practices for infant young child feeding. 32% of Cambodian children in urban areas and 61% of children in urban Nepal and 23% of children in urban Tanzania had consumed sugary snack foods, according to the most recent DHS. So we had an indication that there might be high snack food consumption in these areas. The research objectives were twofold. The first included looking at mothers' exposure to commercial promotions for these commercial food products. These promotions included things like media, in-store promotions, receiving advice from health professionals to use such products, and also children's consumption of these products. So again, we were looking at breast milk substitutes, including infant formula, follow-up formula, and growing up milks, and also commercial complementary foods, such as infant cereal, pureed baby foods, and other commercial foods that might be fed to young children, particularly looking at snack foods. This was a cross-sectional survey conducted at health facilities with mothers of children under 24 months of age who were utilizing child health services. We collected data on the foods and liquids that were consumed by the youngest child on the day prior to interview, and also the consumption frequency specifically of commercial snack foods in the week prior to interview. We asked mothers about their exposure to promotions for these products, and finally gathered basic demographic and socioeconomic characteristics. At the bottom here, you can see the final sample in each study site for mothers, and it's important to note that we had an equal age distribution of children for each of these cities. Going into the results, these are the demographics for the samples that we included in the study. Things to note that are influential for infant young child feeding, you can see that in Dakar, over a quarter of mothers there had received no formal education, compared to Nepal, where around a fifth of mothers had attended university or had tertiary level of education. And also, it's interesting to note that around a quarter of mothers in Dakar and Dar es Salaam and Phnom Penh reported that they worked outside the home. which we know can influence feeding practices as well. And so now we'll go through some of the infant and young child feeding practices that were noted in these different locations. The first is looking at the early introduction of foods for children under 6 months of age. And we can see in Dar es Salaam and Kathmandu, this was a more common practice at 38% and around 25%. It's the most commonly fed foods for these children under 6 months were cereal-based foods. Looking specifically at commercial foods, we see that in Kathmandu and Dakar, commercial complementary foods in sort of the brownish color were being fed before 6 months of age. And consumption of commercial snack foods was very negligible among these very, very young children. Looking at continued breastfeeding, we see that rates of breastfeeding at 1 year were high, particularly in Dakar, Dar es Salaam, and Kathmandu. And then continued breastfeeding at 2 years dropped down, as what we had seen in France's presentation at the global levels, very similar, except for Kathmandu, which remained fairly high at 79%. Looking at some of the complementary feeding indicators across all 4 study sites, we see that the ability to achieve a minimum acceptable diet was low in all 4 of these sites. And that children were more likely to have achieved minimum meal frequency as compared to dietary diversity. So this is a slide showing mothers reporting that they had observed, meaning they had seen, heard, or read a promotion for a commercial food product. In blue, these are the rates for commercial complementary foods. In red, for breast milk substitutes, and in green, for commercial snack food products. And the commercial